Little Longar has been suffering for more than a year. He injured his foot while playing with his friends. His mother says she resorted to traditional medicines initially because it was the nearest option. But after she saw it getting worse, she decided to make the long journey to a clinic to get medical assistance.
The flesh was getting bad. The bone was starting to show, so I took him to the clinic. They fixed the bone, and I don't know if they have already treated him or if they'll operate on him and cut his leg.
Doctors are still assessing if Longar would need an amputation. But that's not the case for Agok Bowl, who recently had her left leg amputated after an injury became too infected to treat.
There's nothing I can do now. If I had my other leg, I would have been able to help myself. Now it's a struggle to cook for myself, to get water for myself. Now I struggle and life is hard. I can still feel the throbbing pain where my leg was.
AJOK is one of more than 50,000 amputees in Africa's youngest country, South Sudan, which descended into civil war in 2013, less than 3 years after its independence from Sudan. Although more than half of the amputees are the result of war-related injuries, amputations also happen for other reasons. 5 years of war has affected delivery of health services to rural parts of the country. Here in Agok, where 150,000 people live, doctors say they performed more than 24 amputations in the past 6 months alone. One of the main factors contributing to amputation in South Sudan is that health centers, particularly those able to treat wounds and infections, are not often within easy reach. Because of that, patients tend to seek traditional treatments and only make the journey to hospitals when it's often too late. Many of those who come to Agok are from neighboring counties. More than half of the population lives in rural areas where there is limited health care. According to the UN, over 50% of health facilities in the country are non-functional. And while proximity to health centers is a reason, doctors say other factors also contribute to delays in getting treatment.
I think it's a cultural problem. When they have something, the first person near there is the traditional practitioner. The biggest challenges for the case of amputation is after the amputation. The very challenge is the rehabilitation for the patient in the society.
A challenge AJOK is already facing, and one Longar's mother ABUK fears her son may have to face if he loses his foot. Hiba, Al Jazeera, Agok, South Sudan.